Hi, this is Scott Sicherer, Associate Editor of Journal of Allergy and Clinical Immunology, and I'm here with Professor Cecelia Berin. She's Associate Professor of Pediatrics at Mount Sinai School of Medicine and the JACI Food Allergy Institute. Dr. Berin has multiple articles that have to do with animal studies and food allergy, and in the recent article in the Journal of Allergy and Clinical Immunology's January 2013 issue, you have a review that's asking the question, what can we do to, or is it possible to have true tolerance in people with food allergy? And you've looked at animal models of this. What are we learning from animal studies?
I think one of the biggest messages from the mouse models of food allergy is that it's much easier to prevent allergic sensitization than it is to reverse it once it's already been established. And so I think we need more research in both mice and humans to understand if we can understand how the route of exposure and the timing of exposure in infants may prevent the development of sensitization by establishing tolerance early on. But I think that there are also two, on the treatment side, there are two main messages that we've begun to understand, and that is that we can modify the allergen so that it can be less allergenic or induce less reactions in sensitized mice.
In what way?
So this has been done in a number of simple approaches. So some allergens are susceptible to heating, and by heating egg allergens or milk allergens, you can prevent their ability to induce reactions when they're given orally. So this is a simple method for making these allergens less reactive, but as immunotherapy, they're just as effective as the native allergen.
So, I'm hearing that the animal models give you a way of sort of quickly looking at both what are some preventive possibilities as well as some of the therapeutic possibilities, and then also looking at some of the mechanisms behind that. And actually, your group also had a recent study that looked at essentially an oral immunotherapy protocol to look if that would create tolerance in the mice. And I think the findings were actually sort of similar to what has been seen in people. Can you tell us a little bit?
Sure. So that model, we mimicked what's being done currently now in human OIT trials, or tried to mimic that procedure. And what we found was that there was really good levels of clinical protection. There was desensitization, but as soon as we removed the antigen from the diet, that clinical reactivity rebounded. So this was a model of desensitization rather than tolerance. And there were some very interesting changes in gene expression in the gut of these mice, suggesting that there might be mechanisms that are happening locally in the gut that contribute to clinical protection.
Well, that's really fascinating, and certainly a neat way to be able to look at things that you can't look at so easily in people. And getting back to this review that you just recently did, there was a figure in this review that focuses on some of the many complicated interactions that go on in terms of achieving tolerance. Can you just give us a couple of the highlights on that?
Sure. So I think that central to the decision of whether we induce sensitization or tolerance in the gut to food antigens is the dendritic cell. So it's an antigen-presenting cell that sits in the lamina propria of the gut, and under normal steady-state conditions, these traffic to the mesenteric lymph node and interact with naive T cells to induce a regulatory T cell response. And that regulatory T cell response can then suppress inappropriate immune reactions to foods. But that dendritic cell that is tolerogenic can be modified by environmental factors. So in mice, we use experimental adjuvants to induce sensitization, and we've shown that that can change the phenotype of those gut dendritic cells.
Great. So I want to applaud you for all the great work that you're doing and all the insights that we get for clinical treatments, and of course the possibilities of novel therapies as well from all these studies. And I'm going to ask you, the listener and viewer, to take a look at this review article and as well as at the other work that Professor Berin and her group have done. So thank you for joining us for this.